وأشهد أن لا إله إلا الله وحده لا شريك له وأشهد أن محمدا عبده ورسوله أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Dear esteemed viewers watching MT Africa, Assalamu alaikum wa rahmatullahi wa barakatuh. May peace and mercy of Allah the Almighty be upon you all. Welcome to this program Health Check, a program which is intended to discuss some of the health issues which we all need, because we all have different health problems. And in this program, we discuss so many things, and you may find yourself being touched in a discussion because of mentioning some of the things that you may be going through. In today's episode, I have a Dr. Steele. He's a very friend of ours who comes always here to teach us, to throw more lights on different topics concerning health. Dr. Akatulinda Bakari, you're most welcome once again.
Thank you. Thank you, dear viewers. As usual, I'm Dr. Baker Akatulinda. I'm here to discuss with us our health issues. And like I always say, let's care for our health because we are fully responsible for it. Dear viewer, you are fully responsible for your health. Number one, you are the number one stakeholder in maintaining and ensuring your health. And therefore, sit back, take in attention. You can get a pen and paper and write down. We shall discuss. We shall pick something, I hope, from this discussion as I'm here.
Thank you so much, Doctor. In today's episode, we are going to discuss about diabetes mellitus. It's a very dangerous disease also, I can mention, and it's a chronic disease actually, whereby if you find yourself in it, you may not be able to move away. You may not extricate from it. So with this discussion, I believe we are going to learn a lot of things concerning diabetes mellitus. Doctor.
Yes, sir.
Can you explain to us what is actually diabetes mellitus?
Diabetes mellitus is a condition which happens when the body has excess glucose than it requires.
Okay.
It is a requirement of our body parts, the body organs, the heart to pump, the brain to think, the lungs to breathe, every part of our body to work, the stomach to digest food and other things. They all require glucose. They require energy from glucose. But now, in instances where the glucose is in excess volumes than required by the body, is what we call diabetes mellitus. In some countries in Africa, they call it sukari, which you can translate as sugar. Because in the layman's language, glucose is sugar.
Yeah.
So when a person has too much sugars in the body, is what they call sukari in local languages. But in medical, for us, we call it excessive volumes of glucose in the body than required.
Okay.
Yes.
Doctor, I used to hear a person tells us that the doctors have said I have type 1 of diabetes. Another will tell you I have type 2. I don't know what is this. Can you please throw more lights on this? What are the differences between type 1 and type 2 diabetes?
Yes, thank you so much. Diabetes is having those two types, as you say, type 1 and type 2. Type 1 is when the body fails to use insulin, does not have enough insulin to work on the glucose. These terms seem to be medical, but I will explain them for you to understand. Insulin is responsible for breaking down the glucose into energy that we use. Now, when the body does not have enough insulin in the body to break down the glucose, is unable to utilize the insulin in it, then it's called type 1. Now, type 2 is, this type 1 usually happens in young children, usually in young children. Now, the type 2, the one which comes among adults in later stages of life, like 30 years, 40 years, when the body has excessive glucose due to intake of excessive sugars than it should.
Okay.
And therefore, the body becomes overwhelmed by excessive glucose and cannot use it all. And therefore, a person gets type 2 diabetes.
Can a person have diabetes when actually doesn't have enough sugar in the body?
Diabetes alone means, I
Too much
put
sugar.
medical language, too much glucose in the body.
Okay, too much glucose.
Yes. So a person will be having too much glucose in the body
Okay.
to have sugar.
Okay.
There is a challenge before I continue, which I must explain. Diabetic patients can have too much sugars or very low sugars.
That's what I was mentioning.
Yes, yes. So there are extremes in the levels of sugars. They may be too high or they may be too low. When the sugars are too low, a person may easily collapse, easily go into shock.
Okay.
So we are required to put some glucose on the patient to raise it to normal levels. So the challenge with this condition is that the volumes keep fluctuating up, down, not in the normal levels.
Okay.
That's the challenge of this condition, diabetes mellitus.
Okay.
Yes.
Now, what are some of the symptoms? Because I may be here also that unknowingly when I have diabetes
yes.
also. So can I have some of the the symptoms or signs that can help me identify myself that maybe I also have before even going to the doctor?
As to understand it better, let me explain it in this way. When you put sugar, okay, if you put sugar or salt in a cup, if it had any drops of water, they get absorbed within.
Yeah.
And therefore, a person who has diabetes will have urgency for water, thirst, excessive thirst. Dear viewers, it is always normal and common for each one of us to have thirst. When you have taken time without taking water or a drink, it is normal to have thirst. But now these ones, they always want to have water with them all the time. They feel excessively thirsty than normal. Then that is a danger sign. It's a symptom of a person to know that I might be developing diabetes. And therefore, they're supposed to run to hospital for a checkup. Another point
Before you go to another point,
yes, sir.
Let me mention this. There are some people like me who can even take 5 days without having that urge of drinking with the thirst of taking water. What's my problem, do you think?
Although it is, I wanted to say like this, although it is not a problem, although it means you don't have diabetes, but still it is unhealthy to take long without taking water. You are restraining, you are doing a disservice to your body organs, because you can imagine a factory without water.
But the system has not asked for it.
Yes, it is trying to hustle to make ends meet, to make things move. But of course, people have different bodies, but usually people don't take water. They can sometimes feel some headache once in a while, or they can feel like dizzy once in a while. Those are all signs for you to take water. But now for a patient, in this case, who have diabetes, for them, they have urgency for water every time they are thirsty. If it happens, then it calls for a person to check. They might be having diabetes when they are not knowing it.
Okay.
Then also, I can't fail to mention about this issue of frequency of micturition.
That's another sign.
Yes, that's another sign. Especially in the night, all of us eat food. After eating food, take a cup of water, and you go to sleep. These people of diabetes, every time they are going for washroom or short call. Okay. Now it is a sign that this person might be having diabetes. Also, another sign I have to mention is some of them have constant headaches which are, let me say, headaches
which persist
and are not having any other medical cause.
Okay.
It's possible to get malaria and you get headache, yes. It's possible when you have typhoid infection to get headache, yes. But this time you have none and still headache is persisting. Okay. It may be a sign that you have diabetes in your body. So that's also a danger sign to look out for these patients of diabetes. And also, these patients of diabetes or people who are developing diabetes, they tend to grow weak. They are just feeling weak. And most of them in our African setting, most of our African countries, I can say about Uganda, which I know, they usually say, I think I have malaria. Now, with our people who still do self-medication, they just go to hospital, get some anti-malarial treatment, drug, and they don't become fine. They go and say, what's the problem? They take Panadol. They don't get fine. They keep weak. The body is weak, as a sign of diabetes. So it is also a danger sign to look for. If you feel your body is weak, and you test all the diseases are not there, the typhoid, malaria, they are not there, then it is very important for your doctor to request for a checkup of diabetes. You might be having diabetes when you don't know.
Okay. Well, thank you so much, Doctor. Yes. As we are moving, a lot of things actually we are learning actually.
Yes.
Now, how can this disease be diagnosed?
For this one, it's very simple, and I will actually later on encourage our people to do regular checkups for this disease also, because it's very simple. In a hospital, when you go, they'll ask you for fasting blood sugar levels test. They pick blood from you in the morning hours before you eat, having eaten only supper. You go to hospital in the morning, the doctor requests for a test, you go in the laboratory, they pick your blood. They do the checkup of the blood glucose levels. Then the doctor will be able to tell whether you have diabetes, whether you are tending to having it, or whether you are free from it.
Okay.
Yes.
As simple as that? As
simple as that. Just check up.
Can we go to the treatment also?
Yeah, this disease can be managed, but it is very, very challenging to manage. The challenge we have faced here, especially in developing countries, is that people go to hospital when it is late.
Actually.
That's the big challenge we have. But by and large, we give treatments. In managing this condition, there are two models we use. We use therapeutic treatment, management.
We would have first discussed about the prevention, then we go to the treatment.
Okay.
Because at least for the prevention, we are trying to help those ones who have not yet got it.
Yes.
Then as for those who have already have it, we shall give them how to treat it.
Yes.
So I don't have it, but I don't wish to have it. How can I prevent myself from?
Yes, beautiful.
From it? Yeah.
Very beautiful question to delve into at this time, because we desire to prevent disease. And these developed countries, what they do, they prevent disease before it comes. They invest a lot of finances, a lot of resources in preventive medicine, and therefore they are saved the burden of curative medicine management department. Now, so prevention is very important. So here we are looking at ways of preventing sugar levels going high. One is eating healthy. Healthy foods, I mean, avoiding too much salty foods.
Okay.
And this I must mention, eating uncooked salt. Usually here in our families, a man says, the food you have cooked for me has low salt. Let me add more.
Yeah.
They just get a bottle of raw salt, they just add. It is not very nice. It's not good. So we need to avoid those salty foods. Also, avoid excessive sugar intake. Dear viewers, I've always emphasized this. It is healthy to make your tea without sugar or with less sugar. You'll be saving yourself the burden, because the more sugars you have in the body, the more challenges. Also, I can't fail to mention about the lifestyle we are living. I mentioned in the beginning and said our bodies require glucose to thrive. Our body organs require glucose because glucose is used to synthesize energy, which is important in the actions of the body organs, the processes, systems, and what. Now, when this glucose is not broken down for energy, I mean, when you live a life which you call sedimentary life, when you live a life when you're not doing exercise, you are not moving, you are stationed in one place, just pumping your body with foods, chips, chicken every time, and then the glucose in the body is not broken down because you are going to use a car to move home, use a car to come back to work, like that. So you are predisposing yourself to high risk of developing this diabetes. That's why usually large percentage of patients who have diabetes also have hypertension.
Yeah.
Also
There's
have
a strong
heart
relationship
problems.
there.
Yes, yes.
Okay.
Usually it's common. I can't throw a blanket statement and say all fat people have diabetes. No. But a big number of people with diabetes also have hypertension. Why? Okay. The risk factors are almost the same.
Causes.
The causes are almost the same. Okay. Because the life they are living, they are eating fatty foods, the glucose is accumulating in the body.
They are not doing exercise.
No exercise. They are taking tea in the morning with a lot of sugar. After lunch break, a lot of sugar. In the evening, a lot of sugar.
Okay.
They are eating red meat. Okay. So they accumulate in the body, and the body is not synthesizing the sugar, in the body, because they are not doing any exercise. So in doing so, they will have the sugar. So just learning how to behave, the behavior change, our behavior of eating, lifestyle, moving, exercise can help us to reduce or prevent this diabetes. Also, I can't fail to mention which I call the standard preventive measure, called early detection and management. In other words, regular checkups. Okay. It is absolutely very civil, very important for a person to go to hospital when you are normal. You say, doctor, check for my blood sugar levels. I see how I am.
So we shouldn't wait for the disease
to first get sick. Yes. No. Okay. We should go. We check our body sugar levels. We know how they are. We can keep monitoring them ourselves. Also, I can mention that those machines for sugar levels are very easy to use. Nowadays, we have automatic machines which give automatic readings by WHO. Okay. You prick yourself and you put the blood, it will read for you and tell you you are in a danger zone. According to WHO, you are in red. That means you have diabetes. Or you are in yellow. Okay. Meaning you are tending to have. Or you are in green, meaning you are normal. So a person can easily trace or check their diabetes levels and therefore reduce the risk of getting the disease. Then also among the risk factors is age. Age, yes. Okay. A child of 10 years will not have a problem with that. It's not common. This one is common in people who are elderly, 45, 50, those elders. That's why mostly our elders are the ones who have this challenge. And therefore, when your papa or your aunt or your uncle or your auntie or your brother gets to 50 years, or even 45 years, it is important, even if they don't have signs, it is important for you or for them to acquire this machine and be testing themselves regularly, or get a doctor, a family doctor, to be checking the sugar levels. Alternatively, go to hospital regularly for checkup. It's very cheap in Uganda, at least, very cheap, very affordable. You can do and monitor sugar levels to prevent this infection. Why in
old age it is very common? Is it because of the weakness of the immune system, or?
I didn't delve into the details.
Or having accumulated a lot of sugar in their body?
Partly, yes, but also this point of the liver. The liver is responsible for the manufacture of insulin, which I talked about
in the beginning.
That is responsible for the breakdown of the sugar levels. Now, as age advances in, all body organs get weak after a lot of time of work. Remember, very many factors come to cause disease. as I explain this, I want viewers to understand me well that a person to get a disease, usually there are many factors which come together. Now, I want you to take a scenario. A person has not been exercising, has been eating red meat, has been eating high sugars, and the liver is working tirelessly to produce insulin to insulin to cut down those sugar levels, those glucose levels. Now, for a long time, now a person is 50 years and is still living the same lifestyle.
Okay.
Now the liver gets tired. Let me use that language.
Sure.
The liver gets tired. And therefore, that's why we say age is a risk factor. And therefore, anybody who is advancing in age should take caution to have these checkups as regular as possible to prevent this disease.
Thank you so much, Doctor. Yes. This problem of diabetes is also affecting very many people, just like pressure. As you mentioned, that these things move together.
Yes.
Mostly, if a person who is suffering from diabetes is also having pressure aside. Now, Doctor, let's talk about people who already have it. How can such people manage their life?
Very, very challenging, yes.
With the treatment aside, but how can they manage their lifestyle?
Yeah, one is management of stress. Usually, among the factors which kill our patients very fast is loss of hope.
Okay.
They lose faith, they lose hope, they know now I have diabetes, now I'm finished. I shared and said mostly is people with advanced age. A mzee of 50 years now is having diabetes. They say, my children, my grandchildren, I think for me I'm going.
Yeah.
Allah is soon calling me, I don't think I will last. So that one alone, within his mind, he loses hope.
Yeah.
So that's why you have challenges, let me say, taming them to eat specific foods. They say, my children. A person comes to hospital and says, doctor, my son, let me eat. After all, I'm soon going to meet my Allah. Allah is calling me soon.
When actually you are prescribing for this person not to eat this, not to eat the other.
To live longer. They tell you, I'm soon going away. So it is a challenge. So those who have been diagnosed with this disease of diabetes mellitus, we need first of all to put in them hope and faith, to know that they will live. They can live actually with the disease. And then we have to encourage them to stop sugary foods. Some of them are told to stop sugar completely. Others are told to eat their food with less salt. Others are told now to do some exercises. Others are told now to limit the fat intake like that. So as to have this behavior which reduces the amounts of glucose in the body, so as to reduce this diabetes.
Okay.
Yes.
Now, how can we treat ourselves? When I have it, I have diabetes, true. And yes, I can go to the hospital and they give me some medicine. I take the medicine. Can that be enough? And can this problem be cured completely? Or I must die with it? Once I'm infected, there's no way I can get rid of it. Is it true?
This challenge here is called chronic infection, a chronic disease. And
by the way, you also mentioned that last time you mentioned that hypertension can be genetic. How about this one? Yeah,
even this one can be genetic actually.
Okay.
Yes. Among the risk factors is genetic. So if a person has had in their family, it's possible for the descendants also to have.
Okay.
That's why I was emphasizing the issue of many factors coming into play. If your father had diabetes, then why are you not exercising? You get? Okay. Why are you eating these fatty foods every time? Why eating excessive sugar in the body? So therefore it is important to make sure we reduce these risks as much as possible. Now a person might not be having a genetic predisposition, or the father might not be having, but because of the lifestyle, they get it. So there are many factors which come into play, and it requires all of us.
By the way, if I get it not out of genetics, and then I happen to get it at this stage of mine, can from that level, I mean from this time, can it start be genetic?
No, there you can't.
Okay.
Yes, if you acquired it from the lifestyle,
Now,
then you can't pass this on to the children.
okay.
Yeah.
We are talking about treatment as
Yes.
we conclude.
Yeah, so treatment, we give tablets to reduce the sugar levels. We give tablets to increase the insulin levels, to reduce it. And therefore, when you add the behavioral changes, we shall go above this. The sugar levels will be stabilized.
Thank you so much, Dr. Katulinda Bakare. Estimated viewers, we cannot exceed from here. Thank you so much. Thanks for watching this program, Health Check. I remain Siwagude Twahir Twalha. Let us meet next time, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.